Insulin injection errors are more common than you may think. In fact, in a survey, it was found that 76% of patients apply too much injection force, which can increase the risk of intramuscular injection. VD Nano 2nd Gen pen needles have a unique contoured base that corrects for different injection forces to help deliver insulin where it needs to go. Experience the difference of a contoured needle base. Consider VD Nano 2nd Gen pen needles.
Hi, everyone. I'm Sandra Levy, Senior Editor of Drugstore News. Today we have Dr. Marc Watkins. He's Chief Medical Officer of Kroger Health. He's here to discuss RSV and ways that people can prevent themselves and their families from getting sick. Hi, Dr. Watkins. Thank you for joining us today.
Yeah, hi, Sandra. Happy New Year. It's always good to talk to you.
Same to you. Thank you. So I'm excited to speak with you. It's getting cold here, and even in warm places, people are gathering during the winter months, and they're spreading viruses. So I was wondering if you could talk about what RSV is.
Happy to do so. And you're right. It is getting cold, and even in places where we know that it's historically been warm, it's cold there too. So RSV, otherwise known as respiratory syncytial virus, is a very, very common respiratory virus that infects the nose, the throat, and the lungs, just like a common cold. So, and many times it's almost impossible to distinguish between flu, COVID, or just a common cold. So symptoms like runny nose, congestion, folks can have decreased appetite. They can be coughing, sneezing, fever. So just a lot of the things that we would see along with very common respiratory viruses, and of note, we're right here in January, and we know that RSV peaks in December and in January, and here we are.
So can you say, how is it spread, and how long are people contagious? And are they contagious before they have it?
That's a great question, right? So you think about how we spread other respiratory viruses. So, we have a lot of history coming out of COVID with understanding how viruses are spread. So when we're in close contact with one another, especially indoors, now that it's cold, right? Just think about that. Someone coughs and sneezes. These respiratory droplets can easily spread. They become aerosolized. We talked about that. They can get airborne, and they could spread very commonly. So you can get these droplets in your eyes and your nose, your mouth when people cough or sneeze. And so, people that get infected. Let me stop there just for a second and maybe add that we learned this from COVID as well with other respiratory viruses. We know it very, very well that a lot of these viruses can live on surfaces. So think about door handles, tables, frequently touched objects, and you could actually touch those objects and touch your mouth or your nose, and you can become infected that way. That's a common way. But again, the most common way is these respiratory droplets that get in the air from people coughing and sneezing. And most people with RSV are usually contagious for about 3 to 7, 8 days, but mainly 3 to 8 days. But you can also be contagious a day or two before you start showing those signs that I just mentioned. So that runny nose, congestion, coughing and sneezing. So you could have this incubation period and then show the signs but be contagious. So that's why when we'll give you some advice about how to keep people safe, but that's why when you're not feeling well, it's best to stay away from others.
What's most at risk? Is it infants, children, senior citizens, or is everyone at the same risk?
No, not everyone. So if you are otherwise healthy without any chronic diseases or having a weakened immune system, the RSV would not pose a significant risk for serious disease or even hospitalization. But infants and some young children could be at severe risk if they're infected. And then, as I mentioned, older adults, ages 75 and above, and those persons with a weakened immune system. And what do I mean by a weakened immune system? So if you are immunosuppressed, if you are say a liver transplant patient, you've had a kidney transplant, you're going through chemotherapy because of cancer, or you're under the care of a healthcare professional and they have made you aware that you have a weakened immune system, you are at risk for serious disease with RSV. So Sandra, you're spot on with the demographics that you just mentioned.
So what steps can people take to prevent getting it?
Yeah, just like I mentioned, right? I think we learned a lot coming out of the pandemic, and I think that the number one lesson we learned was that if you're not feeling well, do your stay away from others, right? Just you don't have to come to work or go to school, but you can also do some really common sense good tips like good hygiene, right? Cover your nose or mouth when you cough and sneeze.
Mm.
Wash your hands. Really, that's a great thing that we can do is beginning to wash your hands and making sure that we take care of good hygiene that way. That's an important part of all of this. Other things that we can do is physical distancing, testing, and then using masks if necessary. But the main thing here is that you can do yourself a favor and get a vaccine. It's available to you, and that can help as well. There's also some steps, and right now it may be a little bit tougher with finding ways to have cleaner air in the home or office when it's so cold outside. But things like good hygiene, covering your nose with cough and sneezes are the best bet around staying away from others when you're sick.
I've often heard also if you keep the windows open, I know it is cold in certain places, but to keep the fresh air coming into the house, the
Right.
rooms.
That's perfect because what it does is it circulates and it's able to when I was in training, we often learned that the uh, solution to pollution is dilution. So bringing fresh air into an environment can dilute that with fresh air. You can bring out some of those pollutants and push them to the outside. So again, it may be a little challenging now, but that's always been a good way of keeping inside air cleaner.
So who can get vaccinated or who should get vaccinated? Is it the infants, the seniors?
Right. So all adults ages 75 and above, we recommend that they get vaccinated, and then adults ages 60 to 74 who are at increased risk. And we went down those risk factors, and so your pharmacist and healthcare provider can go over those risks with you. And all infants whose mothers didn't receive an RSV vaccine, and then finally pregnant people that are between the weeks 32 and 36, they should get the vaccine as well.
How long does it take for the RSV vaccine to become effective? Is it 2 weeks the way COVID vaccine works?
Yeah, it's 7 to 10 days. We think that and it depends. Everyone's a little bit different, Sandra, but usually we say anywhere from 7 to 10 days for you to make adequate antibodies. That's the normal response that happens from a vaccine, and that provides you protection against the virus.
So what other advice does Kroger Health have as far as being safe this respiratory season and beyond?
There's four things that I'd like to just repeat. One, stay away from others if you're feeling ill or you're not well this respiratory season, right, during the winter. Cough and cover your sneezes, right? Make sure that you're doing your part. These viruses can become aerosolized, as I mentioned, aerosolized. They can actually get airborne, and it's the best way to keep others safe. Wash your hands often. That's just a good practice. We learned that out of COVID. Go ahead and wash your hands. Make sure that you're disinfecting surfaces. But also let me just add. I think it's a good opportunity that if you have questions about any vaccine, especially RSV, talk to your pharmacist or your healthcare professional to understand which vaccines are right for you, and is the RSV vaccine something that you should consider for you and your family.
Well, thank you for sharing these great tips, Dr. Marc. I always love speaking with you. Our audience loves to hear from you, and we hope you come back soon and share some more, health tips and other things that are happening at Kroger Health.
Absolutely. It's always a pleasure talking to you, Sandra, as well. You have a good one.
Thank you. You too.